annoyed because I was like, excuse me, but I don't give a damn about my cholesterol right now. I want to get up and dress and be functional. Like, who cares right now? Like, I'll deal with that later if that's a problem even. But right now I can get up and dress myself. You haven't been able to provide me with that for 6 months. And so I'm sorry. Yeah, I'm angry. I wrote a letter. I was pretty upset about the whole thing. And now I feel like even more, I should write a letter. Like, so now it's been a year and guess what? I'm back to work. I didn't actually ever go on disability because my husband and I own our own company and we are very lucky. And so I didn't have to do that, but I would have. I mean, that's the whole thing, right? Everyone else would have had to pay for me and my medical issues for the rest of my life.
But at least your cholesterol would have been lower.
Right.
that's where we've gotten to. It's a shame. It's an absolute shame. Now as a physical therapist, you obviously interact quite a bit with the medical profession. You're part of it basically. How has this experience for you impacted your work? I mean, do you now realize that, hey, maybe changing your diet might help your condition? Because you're going to see folks that it probably would. Has that been something that's been impactful for you? And have you been able to utilize that approach with you said your own business, so maybe you're not under pressure to tell everybody to eat, 60% grains or whatever the hell they tell people to do?
No, thank goodness I am not under that pressure. So I took your course as a carnivore and fasting coach. Mm-hmm. And I also took the American Nutritional Association course on to be a certified ketogenic coach as well. So I really wanted, I'm kind of a geek and I like science and I like to learn stuff. So I really wanted to get as much information as I could, not only for myself, but for my clients. And it is a topic of conversation pretty much with everybody because my clientele is chronic pain patients. I've been treating chronic pain patients since 2015. And so I deal with people that have had pain for decades or more and have never been told and have had multiple surgeries and all of these things to fix their problems and never been told that it's due to inflammation or the fact that, you shouldn't eat a pint of ice cream every night, things like that. So it's, I'm starting to set up a free, what do I want to call webinar? I'm not sure what I want to call it, but here at my office, I'm going to have patients come in and just listen to the talk on how to reverse diabetes or decrease diabetes. I have so many patients. We live in a very small rural area and so many patients are type 2 diabetic and are told that it's a chronic progressive disorder. And I want to break that myth in our little community that it doesn't have to be a chronic progressive disorder and that we can do something about it. And I want them to feel supported since the doctors, I don't feel are supporting them. They just keep giving them more insulin or more metformin and not supporting the education that's out there that I think that if people knew, I know at least most of my clients that know they're willing to try something for a better life. They don't want the amputations. And I will say I'm a little blunt maybe in the fact that I tell them, if this keeps going, you're going to have an amputation. Mm-hmm. And I that may sound rude, but I need them to see it. I need them to picture it. I need them to understand that this isn't just going to stop progressing if they don't stop what they're doing. So yeah, I feel really excited now that I'm able to do these things and create these presentations and get more information out there. In our waiting room, I've made a carnivore pamphlet. It's out there, low carb, ketovore carnivore pamphlet. So when people come in, I don't want to be pushy necessarily because people get put off by that, but I want them to have the information. I want them to I feel like the more we're aware that we can make the change, I don't know. It's like dropping a seed, right? Maybe that seed will grow in some people.
Yeah, no, and kudos for you for being willing to talk about this stuff because many people most people aren't educated enough or don't have the experience to see where the changes that I have seen every day. And I'm sure you see now with regard to chronic pain, how much, things like sugar, or, I'll just use that as an easy target. How much do you see as sugar affecting people's chronic pain, or are you able to notice that?
Yeah, so I did a survey last year of 150 of our patients to find out, kind of what their dietary intake was. It was very generic. It was just 5 basic questions, but I wanted to know, and then I wanted them to rate their pain on a daily basis. And we did this for 30 days. And yeah, they started noticing like, I have horrific pain the following morning after I eat my pint of ice cream, but I only eat my pint of ice cream 3 days a week. So, it's not every day. It's like, okay, I get that. However, do you see the correlation between you eating the pint of ice cream and then you coming into my office hunched over, barely able to stand up? I can't fix that. I'm sorry. I would love to be able to, but I can't personally fix that. You have to change that inflammatory response in your body. So I'm trying again to let people see it in their own life rather than me trying to force it upon them. So yeah, I'm trying to do more of that, just more questions and more people trying to understand what they eat does have a direct relationship to their pain and their inflammatory response.
Yeah, it clearly does. I ashamedly, I'll admit that when I was practicing as an orthopedic surgeon, even more than a decade ago, and people would come in telling me that eating, say, gluten hurt their knee, I didn't believe them. I just thought they were nutty. Come to turn out that they're probably completely spot on. And few people notice that because we eat such a varied diet that it's hard to put 2 and 2 together. I mean, it lets you eat some kind of rare food that you've never eaten before, and then you kind of get this sort of sense that's a problem. But I mean, most of us eat generally hundreds and hundreds of types of food, different products, and we can't put it together. Now, do you mind sharing how old you are?
I'm 43.
43. Okay. So if we look now, some of the skeptics would say, hey, you've cured your neurologic issues, you've cured your gut issues. Why not go to an omnivore diet? All this red meat and saturated fat's going to kill you. It's going to give you a heart attack. So if we talk about like cardiovascular risk factors, I mean, there are many that are out there. And I think, we become sort of myopically focused on just one number, particularly the LDL cholesterol. Some people would say ApoB. We're missing a lot there. So glucose control, inflammatory markers, blood pressure, overall body composition, lipid markers, triglyceride, HDL, LDL. How are we looking at that right now?
So many things. Really quickly, just want to let you know, I was diagnosed with polycythemia during all of this as well. So polycythemia, high red blood cells, high hemoglobin. And I just found out that I do not have leukemia and I will not have leukemia in the future. So it's not an actual bone marrow issue. So
you're looking at all these different labs and you notice you have polycythemia vera. So is your red cell count normal? Is it still high or is it normalized or where is it at now?
Yes, 16.2.
Okay, so it's still high. Slightly high, not super high, but slightly high. Yeah.
Now, and my hematologist said it's pretty good. So I was looking at all these labs and my HbA1c is 4.7. My fasting glucose is still 101, which I thought was interesting, but I do feel like I still have some healing to go on. So I'm not really worried about it because when I fast, it goes down to 82. So
yeah, let me do, because I'll, and that's a good point. I want to comment on this because this is a common thing I see. I don't think you're fasting in 12 hours on a carnivore diet. I think if you want to get a true fasting blood glucose, you need 18 to 24 hours just because of the GI transit time of a big steak or something like that. It's going to sit in your gut for a long time. It's going to slowly break down, and you're probably still absorbing nutrition even the next morning, assuming you've eaten dinner or even a late lunch. So, because you said when you fast, it goes down to 80. So I think your true fasting number is when you're truly actually fasting. Sorry to interrupt, but that's an important point that I think I want to know.
I have a question about that. Yeah. So if I do that, it's because my doctor's like, never fast more than 12 hours before you give blood. But I mean, can I? And that would be okay.
Of course you